Hello and welcome to our institute, the Orthopedic Pain Management Injury Institute. The reason you're watching this video today is because your doctor has diagnosed you with back pain, neck pain, or mid-back pain, what we call spinal pain. Patients who have spinal pain have many options in the treatments. In your case, your diagnosis has been disc damage to your spine. What is disc damage? I'd like to review that with you first because it's important that you understand what the damage is and then make decisions regarding the appropriate treatment. So first patient education, then doctor intervention. I'd like you to take a look at this spine model that I have. This is the lower back area, this is the mid back and the neck. So the head is sitting right on top. In this case, in the lower back area, you'll see we have the bones, one on top of each other. And in between the bones, we have some gel material. This gel is the cushioning between the two bones. It is very similar to the jelly in the donuts. Sometimes the gel or the disc can come out of place. Look at this red one down here. It demonstrates a disc or gel that has slipped out or is bulging out. There are many different terminologies such as a bulge, herniation, disc protrusion. They all mean the same thing. When the disc bulges out, it creates immediate swelling, inflammation. As a result of the swelling and inflammation and as a result of the bulge, there is significant pressure on the nerves. Right here in the yellow part, this represents a nerve where the disc is compressing on the nerve. So this combination can cause back pain as well as pain down to the legs, what you know as sciatic pain. Similar things can happen in the neck area. In the neck, we have again the bones and the gel or the disc in between the bones. Again, a disc bulge here can cause pressure on the nerve, the swelling and the inflammation. So you've been diagnosed with a discogenic pain, pain that is coming from your disc and possible nerve pain that's going down to your arms or to your legs. Besides the pain, you may experience numbness or tingling sensations. We know from our patients that this pain can be devastating. It can cause patients to lose time from work and not be able to do the daily functions. So what is the question here? The question is, what is the treatment? What are the treatment options for this problem? The treatment options are step-by-step process. So we always like to start from the easiest options and then we get to harder options if necessary. The first option is to give the patient some medications for inflammation. We want to take away the swelling and the inflammation. What I want you to understand is, and it's very important to realize that there is no 100% solution. We cannot push this disc that is bulging out. No one can push it back inside. No matter what you read or what people tell you, the disc is not going back in. But what we can do, we can turn off the inflammation, we can turn off the fire. If we can turn off the fire, the pain can go away, you can become more functional. So again, the medication is prescribed against inflammation, maybe for 2 weeks to 4 weeks. We prescribe you with therapy, and you may have already done this type of treatments. If the patient does not improve with the medications as well as the therapy, the next option is injections. What are injections? Well, the injections are not painkillers. That's the most important thing to understand. They are not painkillers. The injection, all it does, it delivers medication directly to where the inflammation or the fire is. The purpose of this medication is to turn off the fire. So I want you to imagine a room like the one I'm in right now, and imagine this room is on fire. And the owner of this room wants to come in and remodel it and clean it and make it look good again, but he cannot come in here unless the fire is first put out. So same thing here into the spine. We like to turn off the fire first, and then your body can start the healing process. The body has a hard time healing when there's inflammation around. So that is the purpose of the injection, to take away the swelling and the inflammation. Therefore, the pain goes away. The same thing can be done for the neck. for the mid back and the lower back. So how is this procedure or this injection performed? This injection is performed in our facility where we have a special room that has the equipment and the supplies necessary to perform this treatment. This treatment involves using a camera. So there is a camera on top of the patient where we can see on the monitor exactly where we're putting the injection. So the whole spine is visualized under the camera. Based on what we see on your MRI studies, then we aim our injection to the correct spot. So this is not a blind procedure. We don't do this with closed eyes. We have eyes, we can see the monitor, therefore bringing the medication directly to the spot without damaging any other structures. The main concern that most patients have is this going to be painful? Is there pain? And I can tell you and reassure you, there is no pain. Okay? The reason there is no pain is because we numb the area pretty good. It's a local anesthetic. Patients will feel pressure. You feel like somebody is just touching your back and pressing on your back. However, nobody's screaming, nobody's yelling, nobody's crying. Okay? It's very important. This is not a torture. This is to make you feel better. Okay? So again, after the numbing medication, we visualize your spine, and then slowly we enter with a needle into the spine and bring the medication directly to the spot. Once we have the spot and it's confirmed on the monitor, then the medicine flows into the disc and takes away the inflammation and the swelling. This does not happen immediately. It happens within the next few days. What can you expect after the injection? Well, first of all, when we're done with the procedure, the patient is taken to the recovery room. In the recovery room, patient is monitored, making sure they're recovering well from the injection. This may take about 15 to 20 minutes or possibly more. Then the patient is discharged home. Most of our patients can be discharged home without any driver. They can drive themselves. They can even go back to work. A lot of times we have patients who come here before their working hours, they do the procedure and go back to work. There is definitely no significant downtime as a result of this procedure. The next question that many of our patients ask, and they should ask, is what are the side effects? Well, you need to know the side effects. They are rare, but they're possible, therefore you need to know. So the number one side effect would be the 2% chance for a headache. This headache can last up to 2 weeks, however, will resolve. The chances of that occurring is extremely low because we're using the camera these days and we know exactly where we're putting the medication. So we don't see this in our office often at all. The next possible side effect is numbness. Numbness in the legs or numbness in the arms that may last between 3 to 4 hours. Again, the chances of that happening is very low at 5% chance. If that happens, patient will stay in our recovery room until the numbness is resolved and then they can go home. So everything so far has been reversible side effects. The third possible side effect is maybe increased soreness or some increased pain in the first 2 to 3 days. The soreness or pain that I'm describing is a slight increase. It's not a pain that you would need to go to the emergency room for or even call our office, but it's a pain that is unusual or different from what you experienced before, and that's as a result of the injection. In order to prevent the pain from happening, we ask the patient to ice their back in the next 3 days after the injection, 3 to 4 times a day, 20 minutes each time. The icing process will help prevent the possibility of some soreness in the back. Again, the chance of that happening is about 5%. Other medical information you need to know: in the diabetic patients who are taking medications for diabetes and be diagnosed with diabetes, there is no problem doing this injection. We have many diabetic patients who are receiving this injection. Therefore, if you're diabetic, you can receive this treatment. The other factors to consider: if you are using any blood thinners, such as aspirin, such as Plavix, anything that makes your blood thinner should be stopped 5 days prior to this procedure to prevent any type of complications such as bleeding. So what can you expect when you come to our surgical suites? In our surgical suite, first you go to the reception where you'll check in with the receptionist. We'll take some information from you. fill out some paperwork, and then you have a chance to talk to the nurse. A nurse will take you to the back office into the pre-op area where your blood pressure, your heart is monitored to make sure that you're in a stable and good condition to go ahead with the injection. The nurse will ask you questions about your allergies, about your other medical problems, and your medications. Once the nurse does her assessment, then the doctor will walk in and discuss the injection with you once again. At that time, you will have plenty of opportunity to discuss with the doctor any questions you may have or any last wishes you may have before starting the injection. The patient is then transferred into the surgical room where you'll be laying down on your stomach. The camera or the fluoroscopy will be situated on top of you. At that time, the doctor will start the cleaning of your back, making sure the spine and skin is very clean. Then the medications are drawn and prepared with the use of the medical assistant and the nursing staff. At that time, the procedure starts. The procedure may last about 15 to 20 minutes, after which you are transferred into the recovery room where again your blood pressure, your heart rate is monitored. Once you're feeling great, then you'll get up and leave. You'll be able to drive and or go to work. Well, I hope that this educational video has been helpful. The purpose of the video was to teach you first and give you the options that you have in the management of your back pain or neck pain. I hope that in our office we'll be able to help you and provide you with the best care possible to return you back to normal function. Have a wonderful day.